Hi, I'm Dr. Allan Oolo Austin, the founder of Trigenics, Functional Muscle Neurology, and I'm going to be talking to you about 4 keys to building your practice with Trigenics. I'm going to talk right now about the first key, which is having a core differentiator. With Trigenics, you will set yourself above and beyond most of your peers in the sense that you will have an actual core differentiator that enables you to be something more than, something that gives you an area of expertise that others don't have. And that will enable you to attract new patients that otherwise wouldn't be coming to see you if you were basically the same as all of the other therapists or doctors in your town or in your area. Why is Trigenics a core differentiator? Trigenics is a core differentiator because Trigenics was the first assessment and treatment system that really focused on aberrant sensory motor control, aberrant neurological or neuromotor control of movement. And movement is the essence of life, or movement is really the essence of health. And any form of aberrant motion due to an imbalance of the pull patterns and the behavior of the musculature that attaches to the bones and that causes movement of the joints is going to lead to deleterious effects, which are basically going to create pain. Those effects are stress on the tissue, inflammation, irritation of the nociceptors when the mechanoreceptors, the first 3 types of mechanoreceptors, cease to function as well as they should. The nociceptors, which are a type 4 mechanoreceptor, that information goes up as the mechanoreceptor information goes down and movement is lost. The brain needs to know when something is not moving properly because it's a warning that something could really go much more drastically could go wrong. That's where pain comes from, basically from most neuromusculoskeletal conditions. That's the type of weak, short, imbalance pattern that has been spoken about by such notables as Jan Dunlevin, Lewitson, and other notable therapists and doctors in the field of physical medicine. So Trigenics, what it brings to the table is, others have come along and said that an imbalance in the pull patterns of muscles is what leads primarily to most musculoskeletal pain syndromes, but no one had figured out the real way to correct that. With Trigenics, you have the core differentiator of knowing how to not only correct that, but how to gain those results immediately in the first visit, no matter how many doctors or therapists they've seen, no matter how long they've been going for therapy, no matter how poorly they've responded to therapy. You can guarantee your patient, if you're able to do that, you can basically guarantee your patient that with Trigenics you will get results that are sustainable and that are far more dramatic than any other results they've had with any other treatment. Most people that come to see you, if you have a core differentiator like that, are going to come to you after having been to other doctors and therapists first, probably because of the fact that your fees will also be higher having a core differentiator. But why is that beneficial? That's beneficial because you'll be able to actually be less stressed out in your practice by seeing less patients and also making more money. That's breaking the traditional paradigm of having to see more people to make more money. You don't have to do that with Trigenics. So there's actually a couple of reasons right there why Trigenics will help you build your practice and decrease your stress load at the clinic that you work at. So I'm Dr. Allan Oolo Austin. That's your first key to building your practice, is having a core differentiator, and I'm sure that if you investigate Trigenics, you will find that Trigenics can be that core differentiator for you. Thanks very much.